Minister, there is an ongoing crisis, as you know, in Ireland for children's mental health services, and 13 years after the publication of a Vision for Change, the services are still completely understaffed. Too many children continue to be admitted to adult units. Waiting lists and waiting times are long, and a renewed focus is needed to reduce the services deficiencies. Minister, I know you've been a visitor to my own county, and I know you feel passionately about this yourself. And what I have come across or found to be the source of the problem in my own area is recruitment and the staffing issue. For example, in July of last year, recruitment or the number of vacancies fell from 51, and I would have to say on a positive note down to 10 is where we're at now in terms of vacancies that are available. So that's a positive thing in the service. However, there is 248 children at the moment on the waiting list to be seen. We've all had, I suppose, different experiences of parents coming to us with their children, some very young children, you know, who need that assistance, who need that intervention, and of course it spills, the effects of that spill over to their school, their attendance to school, their ability to go to school, things that most children take for granted. So, I mean, we can never emphasise enough the importance of proper mental health services within our regions. An issue that came up, as I said, probably loads of TDs have had the same problems, where children being admitted to adult services and adult units. And I was never really aware of that till parents came to me about it themselves. A little first year who was being admitted to an adult service, and of course the parents were more than shocked at the time. And as a result, they refrained from taking up that hospital bed because they felt that wasn't the right place for their child, and they felt it would only add to his illness. And that meant that they had to give 24-hour care to their child at home. So they had 3 other children in the house, and how they actually managed that, I'm not quite sure. But they were insistent that that was the only way to deal with their child, because going into an adult service or into an adult bed or an adult unit was not the thing for a child. I think we are all in agreement that that isn't the way to deal with children who suffer from mental health issues. The number of children admitted to adult mental health units stood at 65 as of September 2018. Minister, if this trend was to continue for the remaining months of 2019, then 86 up to 87 vulnerable young children will be inappropriately accommodated this year, a number that will exceed the previous year. The total number so far is greater than it had been in 2016, and shows that the standards in this area have regressed after improving for a number of years prior to that. The Mental Health Commission have previously said that it is a clear breach of human rights and for the dignity of a child. In 2017 also saw an 20% increase of the number of children admitted to adult mental health units. Minister, it is simply unacceptable and is not the right way to deal or address with this problem, and it is contrary to what state policy is. It is especially disappointing as there has been progress in previous years, and to see that halt, and in some cases reverse, is an indictment of how we are treating children with mental health issues. We are also concerned by the fact that the Department of Health does not track the number of children, the number of times a child has been readmitted to the same adult mental health unit. The Vision for Change mental health strategy made clear that Ireland needs at least 100 beds for children and adolescent patients in order for it to meet the demand. However, the closure of beds during 2017 meant that at one stage just 52 beds were available for children and adolescent patients. Minister, I can't emphasise how passionately I feel about it. I know you do, and a lot of us across the House, because we all know children, be they relations, be they constituents who are coming in and out of our office. You know, when parents come to us, it's usually the last chance saloon for them, because they have tried all the other options that are available to them. And schools are up against it, principals are up against it in terms of keeping their students in school, because when mental health gets a grip of young people, it's very, very difficult for them to get control, and parents need the support. Schools need the support, and as I said, I can't emphasise enough the importance of putting the funding into this and ensuring that the Vision for Change actually is a vision for change. Thank you.